what is multiple sclerosis? The number one first box. And second box, if the question is, why this is happening? So these are the boxes of some of the introductory talks before going to the full down of the disease features, my dear, the next box. How come the optic nerve is affected? The answer is, my dear, the myelin sheath from the central nervous system, the myelin coverage, the optic nerve root. So whenever the cerebral syndrome is a concern, definitely you should think about the multiple sclerosis, my dear. So this is called the disease starts at the relapsing remitting variety, but ending as a progressive disorder. The scenario will be given, my dear, then they will ask you which part of the things or nervous system is affected. So you need to know that sometimes the questions are hitting usually in part 1 exam, the most common symptoms of multiple sclerosis. Yes, in that. So what will be the answer? So yes, my dear doctor, I'd like to discuss the multiple sclerosis. I'd like to start with the multiple sclerosis. What is this? What is multiple sclerosis? If the question is arise, what is multiple sclerosis? Multiple sclerosis, my dear, listen very carefully, is such a disorder of central nervous system. In a single line, if I'm saying that multiple sclerosis is a cell-mediated autoimmune disorder of demyelinating central nervous system. In a single line. So I'm saying the multiple sclerosis, I'll give a box, my dear, so that will be helpful. Let's start with the multiple sclerosis, the box, my dear. Multiple sclerosis is an, yes, my dear, the autoimmune disorder. If I'm saying the autoimmune disorders of demyelination of central nervous system. And this autoimmunity is a cell-mediated, yes, my dear. So the multiple sclerosis is an autoimmune disease and definitely is a cell-mediated autoimmune disorder. And what is the problem? Problem is the demyelination, my dear, and demyelination of central nervous system. Let's talk a little bit further of this important each and every thing, my dear. So multiple sclerosis is a cell-mediated damage of autoimmunity, definitely the first word that you know. Simple questions sometimes can be set up in your exam, especially in MRCP Part 1 exam, my dear. You'll get the simple question, multiple sclerosis scenario. Then they will say, what is underlying pathogenesis? Then they will put on the cell-mediated autoimmune disease, immune-mediated autoimmune disease. So the answer will be the cell-mediated autoimmune disease, my dear. So yes, the next one, the demyelination. So the next word is the demyelination. Demyelination, my dear, listen very carefully. D for delete, myelination means the myelination sheath will be damaged. So demyelination, the word, the myelin sheath of the central nervous system means the brain and the spinal cord is both the myelin sheath, the covers of the myelin sheath of each and every nerves in the central nervous system in the brain and in the spinal cord are formed by the oligodendrocytes, the cells, my dear. The name of the cells is oligodendrocytes. What I said? The oligodendrocytes. These multiple sclerosis, my dear, listen very carefully. The target, this autoimmunity, the cell-mediated damaging target is a myelin sheath, means the oligodendrocyte is the target. Sometimes the scenario says that what is the target or what is the cell is damaged in multiple sclerosis. So definitely the answer should be the oligodendrocyte cells, my dear. Means the oligodendrocyte cells is responsible for these coverings of brain and spinal cord. So definitely the multiple sclerosis, the disease is damaging, of course, is damaging, this sheath is damaging, means the main target is the oligodendrocyte cells. And it says the central nervous system, so definitely this is brain and spinal cord. Why I'm saying a very simple talks, my dear, here? Because I have some aims and objectives to make you to understand very clearly of this disease, my dear. Very simple, the 3 important words that I said, my dear, is a cell-mediated autoimmunity. So the first one is the cell-mediated. Yes, cell-mediated demyelination and the central nervous system. These 2 important words that you need to remember for the multiple sclerosis disease to understand. Now the second question, if I'm asking, what is multiple sclerosis? The question is, what is multiple sclerosis? The first question, the number 1 first box. And second box, if the question is, why this is happening? The second box, my dear, of multiple sclerosis, why, means what is the etiology? Yes, my dear. Multiple sclerosis etiology, yes, we don't know, my dear. It's an idiopathic disease. We don't know. The exact etiology, we don't know about it. Yes. Some factors, the multiple factors are responsible. Multiple factors are responsible for the multiple sclerosis, for the damaging process of autoimmune disease, the cell-mediated autoimmunity, and damaging the oligodendrocyte, means the myelin sheath, causing demyelinations, my dear. So multiple factors, among the multiple factors, I must tell some geographical, I must say, some geographical factors. It is said that the higher latitudes is the single word, the higher latitudes. Yes, the higher latitudes is responsible. Rather than the tropics. And other important factors, some genetic factors, it is said that the monozygotic twins and also the dizygotic twins are both responsible. Yes, of course, they have the chances to have this. And the concordance says that monozygotic twins is the 30% and dizygotic twins is the 20%. Just having a small notes idea, because sometimes the exams is hitting these questions. So some genetic factors, some geographical factors, some other factors may be associated for this autoimmune process to play the role to damage the oligodendrocyte, means to induce the cell-mediated immunity to cause this multiple sclerosis. So the summary talk once again from this second box, multiple sclerosis, why? The etiology. Why? The question answer is idiopathic process, my dear, and the multiple factors are responsible, and the word is the high latitudes, and the mono and dizygotic twins is the di for, yes, this is definitely, yes, my dear. So that this 30% and this should be the 2%, my dear, rather than 20%. So you just write it down, it's 2%. Rather than 20%. Yes, this is 30% and monozygotic twins is the 30% and dizygotic twins is the 2%. Sometimes, very rarely, the questions are hitting this one. So just keep it in mind, my dear. That's it. So this is all about the multiple sclerosis. What is multiple sclerosis? And second question is why this is happening, the multiple sclerosis. Yes, my dear. Next to the second boxes of the multiple sclerosis, what is multiple sclerosis and why this multiple sclerosis, means the etiology. The third important boxes that I'd like to write down here, yes, this is boxes. The MS types, my dear. MS types. I love to discuss a very little discussions that will be really helpful, writing down the number 1. The most common variety of multiple sclerosis is a RRMS, my dear. Write down RRMS. Means the relapsing remitting multiple sclerosis. Relapsing remitting variety of multiple sclerosis, this is called the RRMS, my dear. Second topic, second variety that should be written down, that the clinically isolated syndrome, means the C is clinically isolated syndrome. And third is the secondary progressive multiple sclerosis. And number 4 is the PPMS, means the primary progressive multiple sclerosis. Yes, my dear. RRMS, CIS, SPMS, and PPMS. So once again, starting with the relapsing remitting multiple sclerosis is multiple sclerosis, my dear. What does it essentially mean? That means, my dear, 80 to 85% cases of total variety of multiple sclerosis is RRMS. So that's why essentially multiple sclerosis is nothing but RRMS multiple sclerosis. When I speak MS, think about RRMS, my dear, because it's the most common variety. Sometimes the questions are hitting, this is around 80 to 85%, my dear. Another talk, my dear, another type that is called the clinically isolated syndrome. It's a new term, my dear, the new entity for the multiple sclerosis diagnosis, for making the diagnosis earlier, having potential to develop the full blown of the multiple sclerosis of relapsing remitting variety of multiple sclerosis. What does it mean? The clinically isolated syndrome, the word itself says that, yes, there will be a clinically isolated symptom or syndrome. So this is a very, yes, the common variety actually, this is under the relapsing remitting variety of multiple sclerosis, but the secondary progressive multiple sclerosis around like the 10 to 15%, and once again the primary progressive multiple sclerosis around the 5 to 10%. Yes, I'd love to discuss a little bit further of this each and every type so that you can understand, yes, my dear, what does this RRMS really mean? Relapsing remitting multiple sclerosis. The word itself says that the disease is a variety of relapsing remitting patterns, my dear. Means whenever the relapses, the disease will present to you, my dear, as a doctor. So yes, whenever the remission means there will be no or less or reduced variety of the symptoms. So this is called the remission. So this is the relapsing remission will go on. The graph will be like this, graph will be like this. That will be the relapsing remitting variety. And clinically isolated syndrome, only the single syndrome. And secondary progressive means the patient starts with the relapsing remitting, then progressive variety. And primary progressive variety, that disease started like this and that will go like this. So this is called the primary progressive. So if you see the 4 graphs, what does it mean, my dear? Relapsing remitting variety, the patient will have the symptoms and then the remission. Once again, the symptoms and the remission. I discuss later on the total disease that you can understand, my dear, after going through the clinical features so that you can understand very well. I'll give some of the examples. Second disease, the clinically isolated syndrome, only the single symptom that presented to you. So you are suspecting, yes, the patient had the potential to develop the multiple sclerosis, the full-blown multiple sclerosis later on in their lives. And third is a secondary progressive. The word itself says that patient starts with the relapsing remitting variety, then turn to the progression to ending their life to the wheelchair bound, something like that. So this is called the secondary progressive multiple sclerosis. And primary progressive means the disease starts with the one symptom and these symptoms will progress to up to the ending points. Few examples will be helpful, my dear. Starts with the relapsing remitting variety of multiple sclerosis means the patient starts like a young female presented to you with the loss of vision. A young female presented with the loss of vision. So this is the relapsing. So after 5 years or maybe 2 years, after 1 year, or maybe the 6 months later on, there will be another presentations of some pins and needles in the hands and feet, some of the paresthesia, or maybe the leg weakness, my dear. So this is the relapsing remitting variety of the different symptoms in the different times. So this is the RRMS. Secondly, the clinical isolated syndrome means the young female presented with the loss of vision. Yes, only the syndrome. Or maybe the patient presented with the young female presented with the pins and needles. Or maybe the patient presented with the leg weakness, or maybe the young female presented with the cerebellar syndrome. Yes, only the single syndrome. Now you can think about, yes, there is a potentiality to develop the later on the relapsing remitting variety of multiple sclerosis. There is a high likelihood of chances. So in that case, this is called the SEAS variety, means the clinically isolated syndrome. Third variety, the secondary progressive. Secondary progressive means that, as I said, that, the young female starts with the loss of vision, and after 1 year starts with the leg weakness. And leg weakness starting point, it was like the 4/5, the weakness, but it progressed to, without any remission, it progressing to 3/5, then 2/5, then ultimate the wheelchair bound. So this is called the disease starts at the relapsing remitting variety, but ending as a progressive disorder. This is called the secondary progressive. And the word is to say the relapsing remitting, then secondary progression. So that's why there's secondary progressive disorder. And last is the primary progressive. Means the disease starts with the symptom and then deteriorating day by day, years and years. That is the patient present with the leg weakness, 4/5, then deteriorating 3/5, 2/5, 1/5. That is the progression. This is called the primary progressive. This is the very rare and very cumbersome disorders, my dear. Is not very good prognosis. So yes, so the third box, as I said, the multiple sclerosis types, my dear, I'm saying the relapsing remitting MS, that you must know, that is the most common variety of multiple sclerosis. This is the third box, my dear. This is, you need to know the third box. Yes. And the last box, maybe the fourth box that I'd like to talk. Yes, once again, there's a multiple sclerosis, as I was describing. This is important. The other box, multiple sclerosis, that's its box, is a disease. You see the MS, means young. Young. Means young female. Young means it is written in your notes, you'll see the 20 to 40 years. Yes, my dear. The female, the disease. Yes. The disease usually occur in a young female. Usually the disease is a young female. So whenever you talk about the multiple sclerosis, you should feel that it's a female, the young female. The disease is presenting to you, my dear. So these are the boxes of some of the introductory talks before going to the full blown of the disease features, my dear, the next box. All right, my dear. Now I'd like to talk a very important thing, my dear, how the multiple sclerosis is presented to you, means the clinical features, my dear. Let's start with the new boxes. Yes, my dear, the multiple sclerosis, the clinical features. So, my dear, listen very carefully. The multiple sclerosis is defined by the McDonald. That's why the multiple sclerosis, the diagnostic criteria is depending on the McDonald's criteria. But this McDonald criteria is also modified. So that's why currently the modified McDonald's criteria is applied to make the diagnosis. But the modified McDonald's criteria is a complicated one. I will give it a very shortest and simplest things, my dear, to grab and clinch the diagnosis from the clinical scenarios and even in your clinical practice, my dear. So let's do it. So yes, my dear, I'd like to talk the multiple sclerosis, some of the important boxes that will be really helpful. Let me start by the multiple sclerosis, the SS box. Multiple sclerosis, the first box, my dear, that you need to know, there is a young female love, my dear. Young female love means a young female presented with the love. Young female love. Yes, this love without E for eye means the V for vision, my dear, means the loss of vision, my dear. So this is one of the most important variety, usually the multiple sclerosis, the presented to us, my dear. The young female loss of vision. What I said? The young female loss of vision. Yes. And this loss of vision, there is no eye. So this loss of vision basically is a subacute onset and subacute recovery. What does this subacute really means, my dear? acute, subacute, chronic, these three important words, acute, subacute, and chronic, hours to days, days to weeks, and weeks to months. It does mean the acute is the hours to days, subacute is a days to weeks, and chronic is a weeks to months, my dear. So subacute onset and subacute recovery, it does essentially mean that yes, the young female presented with the few days of loss of vision. Means the young female presented with the loss of vision that goes on few days and with the subacute recovery. So this is the subacute. Why, my dear? Listen very carefully. Because the multiple sclerosis is a disease of demyelination, and demyelination needs the days to weeks, my dear. This is important. Means the demyelination means the myelin sheath is damaged and it needs the duration, the days to weeks. So that's why this is a subacute variety. So subacute onset of the loss of vision and subacute, yes, my dear, the recovery. And this loss of vision is nothing but is due to the optic neuritis, my dear. The word itself says the optic neuritis, so that should be optic nerve, the myelin sheath. Now the question, you said that multiple sclerosis is the disease of the central nervous system. So how come the optic nerve is affected? The answer is, my dear, the myelin sheath from the central nervous system, the myelin coverage, the optic nerve root having an extension from the central nervous system myelin sheath. So whenever, yes, my dear, the myelin sheath is inflamed or damaged by the process of autoimmune damage, my dear, means autoimmune disease process. So the optic nerve is also damaged. The root of the optic nerve is covered by the myelin sheath of central nervous system. That's why the optic nerve is preferable and one of the most important cranial nerves, or the most frequent optic nerves, means the cranial nerves is affected, my dear. There is a optic neuritis. So optic neuritis will have the painful subacute variety of loss of vision. Yes, my dear, the painful subacute loss of vision, optic neuritis. And these optic neuritis ultimately leads to optic atrophy, and we'll have the photo of the optic atrophy, my dear. In another chapter, means ophthalmology, you will be studying my optic atrophy. And optic atrophy will have the APD variety, means the RAPD, means the relative afferent pupillary defect, my dear. So it's a separate things that will be taught in ophthalmology section, my dear. But at least that you need to know the multiple sclerosis, the young female with the love, and that is nothing but the optic neuritis that leads to the optic atrophy. And this is APD, means the relative afferent pupillary defect. So one of the important syndrome that you need to remember. Yes, my dear. Next to the optic neuritis leads to the optic atrophy. One of the important things, my dear, that is the number 2. This is important. Yes, my dear, you need to know the multiple sclerosis also having some of the features of INO. What does this INO really means? INO means the internuclear ophthalmoplegia. Internuclear ophthalmoplegia is a important, my dear. Sometimes the unilateral, means the right-sided INO, or maybe the left-sided INO, or bilateral INO is also more common in multiple sclerosis. So INO means the internuclear ophthalmoplegia is a specific term that is usually caused by multiple sclerosis. So you need to know them. What does this INO really means? Internuclear ophthalmoplegia is a very complex term, and understanding is a complexities. But I will give you the very shortest and very simplest things, my dear, so that you can understand very clearly. So I would love to describe the word it says that you feel that it said that the internuclear ophthalmoplegia, so this is internuclear, so the two nucleus connected by a fascicle. This fascicle is known as medial longitudinal fascicle. Yes, my dear, medial longitudinal fascicle. So this nucleus is nothing but the third cranial nerve, And this nucleus is nothing but the sixth cranial nerve. So the third cranial nerve nuclei, this is the sixth cranial nerve nuclei, connecting nerve fibers, that is called the medial longitudinal fascicle or medial longitudinal bundle, whatever you can say, my dear. So the medial longitudinal fascicle is responsible for connecting these two nucleus. This third nerve nucleus in the midbrain, yes, and sixth cranial nerve is in the pons, my dear. Is in the midbrain, yes. So my dear, listen very carefully. So internuclear ophthalmoplegia, the word says that the internuclear, the fascicle is affected. Means INO equal to medial longitudinal fascicle lesions, my dear. Means that if the MLF is affected, that leads to the internuclear ophthalmoplegia phenomena. What does this internuclear ophthalmoplegia phenomena? I would love to describe a little bit. Yes, my dear. What is this? Let's discuss a little bit further. So this is your eyeball. Yes, my dear. If you look on the left, what will be happen? There will be a conjugate eye movement. The left eyeball will go there and the right eyeball will go there, right? Means, just feel it, my dear. The left eyeball, if you look onto the left, so the left eyeball looks at, on the left side, it does mean the left eyeball is abducted and the right eyeball is adducted. So this is the adduction, this is the abduction, right? So this is the thing, my dear, in the conjugate eye movements. Let's talk a little bit what happened in medial longitudinal fascicle, my dear. It happens that when the medial longitudinal fascicle is affected, that is called the internuclear ophthalmoplegia, that leads to the internuclear ophthalmoplegia. So, feel that this is right-sided medial longitudinal fascicle. This is the right-sided medial longitudinal fascicle is affected, that leads to the inability to adduct. So, this is the eye, this eyeball will be here rather than here. So, this is inability to adduct, number one. The second important point, there will be a nystagmus of abducted eye. And third component is correction of adduction. The correction of adduction, yes, if you close by your hands, the abducted eye. If you close it, the correction of adduction. So these three phenomena is called the INO. So what I'm saying, my dear, listen very carefully. I am writing the INO, I-N-O, my dear. I for inability to adduct. Just write it down. Inability to adduct. N for nystagmus at abducted eye. Just write it down. Yes, my dear. Nystagmus at the abducted eye. And when you close the abducted eye, there will be the correction, O for correction of adduction with closed abducted eye. So these three phenomena all together, we call them internuclear ophthalmoplegia. So I put And I made it very simplest things, my dear, so that you can remember fast and then work it out to understand, my dear. So say with me, INO means I for inability, N for nystagmus, and O for correction. Inability, nystagmus, correction. Inability, nystagmus, correction. Inability, nystagmus, correction, my dear. So inability to adduct, the first word, N for nystagmus in the abducted eye, and closer of the abducted eye, the correction, O for correction of adduction, my dear. So these three phenomena put together, the scenario is put together called the internuclear ophthalmoplegia, my dear. So if it is right-sided INO, means the right-sided MLF will be affected. Similarly, right-sided eye will be inability to adduct. So that's why, my dear, just forget them. If you go through the scenario, if you have seen, but if you see, the right eye is unable to adduct, so keep it in your hand. So yes, this is right-sided MLF is affected, it's right-sided INO, my dear. If it is written in your scenario, the right-sided eye is inability to adduct, and also left-sided eye is inability to adduct with some nystagmus in the both eyes. So definitely, this is bilateral INO, my dear. Or if it is only left eye is unable to adduct, so this is left-sided INO, left-sided MLF, my dear. The scenario will give you given, my dear, then they will ask you which part of the things or nervous system is affected. Left-sided MLF, right-sided MLF, left-sided third cranial nerve, left-sided sixth cranial nerve, right-sided third cranial nerve, right-sided sixth cranial nerve. So what will be the answer? So yes, my dear, just grab it, my dear. What is that? The inability to adduct, my dear. Means you put and get the word, my dear, adduction, inability. So yes, so INO is a term, as I said, my dear, internuclear ophthalmoplegia is a complex phenomenon of the nerve fibers that leads to the internuclear, means the conjugate eye movements, the complex eye movements is possibility. Yes, my dear. When the eye means the medial longitudinal fascicle, which fascicle is connecting the two nucleus, that's why this is called the internuclear ophthalmoplegia. So yes, that leads to this term, my dear. So the first one, as I say, the multiple sclerosis, the young female love, as I say, the optic neuritis, optic atrophy, RAPD, and next is the internuclear ophthalmoplegia. So this is all about the eye features that you can remember, my dear. This is all about the eye features. You can write down the boxes all together. Yes. Now I'd like to give the second boxes. It's really important. You can write down the plus. The second boxes, my dear, is the spastic paralysis plus dorsal column sign plus spinothalamic tract sign. So this is another box. You will have a lectures, my dear. I'll give you the lectures of the syndromes of the spastic paralysis, the dorsal column sign, the different varieties of the syndrome, different differential diagnosis. You'll have the impulse of opportunities to learn them very wide ways, my dear. And the third box, once again, the spastic paralysis with cerebellar syndrome. Yes, my dear. Is another box. Spastic paralysis is the cerebellar syndrome. It's a cerebellar syndrome. Yes, my dear. Means the different varieties of the ways usually the multiple sclerosis is affected. As I say, the young female love, optic neuritis, optic atrophy, RAPD, INO. Just remember, my dear. The second variety of the group of things, my dear, you need to remember. Yes, you should think about. This is number 2. There is a spastic paralysis, the dorsal column sign, spastic paralysis with the dorsal column sign, the spinothalamic tract sign. Usually, the spinothalamic tract signs are affected, and also pins and needles and paresthesia and the different varieties of the syndromes. And also, the trigeminal neuralgia is another part, another nerve is the cranial nerve is affected later on. So you need to know which another cranial nerve is affected in case of multiple sclerosis. The trigeminal neuralgia And next is the spastic paraparesis, once again with the cerebellar syndrome, my dear. In United Kingdom, cerebellar syndrome, the females, the most common cause of cerebellar syndrome in United Kingdom is multiple sclerosis. So whenever the cerebellar syndrome is a concern, definitely you should think about the multiple sclerosis, my dear. So this is the third variety of syndrome that you need to remember. Once again, yes, this is second, this is third, yes, spastic paraparesis is cerebellar syndrome. So these are the syndromes, my dear, that you need to know. These are the variety of the syndromes that are in the multiple sclerosis. So once again, I'd like to talk and just go with me, my dear. Multiple sclerosis, once again, MS means, all right, you can remember, young, female, loss of vision, 𝗟𝗏𝘃 𝗟𝗏𝘃 recovery, optic, neuritis, painful, tender, loss of vision. And that leads to the optic neuritis, that leads to the optic atrophy, A for atrophy, A for RAPD, and next is the, definitely you should think about the internuclear ophthalmoplegia. Alright, so the next one, my dear, listen very carefully. The second is the spastic paraparesis, dorsal column sign and the spinothalamic tract signs. If I go through them, yes, just come back to me. Spinothalamic tract sign, STS. So that usually the pins and needles and dorsal column sign. So there are two important phenomena that you need to remember. One is Uhthoff's phenomena. If I'm writing the Uhthoff's phenomena, Uhthoff's phenomena, the word is to say is that, my dear, I'm giving the definition of Uhthoff's phenomena. Whenever the body temperature rises, yes, the symptoms are rises. Means the symptoms are increasing, my dear. Means the symptoms means the vision is deteriorating. So T for temperature, you need to remember, yes, the temperature, the body temperature is rising, T for Uhthoff's, the T for temperature is rising, leads to the vision deteriorating. So this is called the Uhthoff's phenomena. And next to the Uhthoff's phenomena, another term is the Lhermitte's sign. Lhermitte's sign means the L for, I'm telling you, my dear, lightning sensation. Lightning sensation means the paresthesia, my dear. L for lightning sensation means the paresthesia down the forelimbs, upper limbs and lower limbs. Whenever the neck is flexed, when the neck is flexed, you'll feel a paresthesia, the lightning type of sensations down the upper limbs and lower limbs that usually occur in case of multiple sclerosis. And there is a differential diagnosis of cervical myelopathy. You can write it down as small box of the cervical myelopathy, the Lhermitte's sign. So these are the two scientist phenomena, the Uhthoff's phenomena and the Lhermitte's sign. Uhthoff's, you can say the TT is the temperature, vision deteriorating, and Lhermitte's the lightning sensation, yes, my dear, down the upper limbs and lower limbs on neck flexion. Usually multiple sclerosis, when the spinal cord is affected and or maybe the cervical part of the spinal cord is affected. Whenever the cervical myelopathy also can cause this Lhermitte's phenomena. Other than these symptoms, yes, the third syndrome, the spastic paraparesis, the cerebellar syndrome, as I say, the cerebellar ataxia, tremor, cerebellar syndromes will be there. So you need to know them very well. And after some other non-specific symptoms can be affected, my dear, this is, you need to know, that is at least you need to know the urinary incontinence, yes, my dear. And sometimes the sexual dysfunction, some intellectual deterioration that you know, my dear, but the urinary incontinence that you need to know, yes, my dear. So, my dear doctor, as I say, the different varieties of the syndrome, they're starting with one, young female love, the spastic paraparesis dorsal column sign, the spinal tract sign, and then the, or just you can say the spastic paraparesis with the dorsal column sign only. If you think about it, only the spastic paraparesis, the dorsal column sign, and the spastic paraparesis with the cerebellar syndrome. But my dear, listen very carefully, you'll be amazed to know more than 75% patients of multiple sclerosis are having no symptoms, but sometimes, yes, among them, the most of the people are affecting they are only presenting with the extreme fatigue. So that's why the box that I'd like to discuss, yes, my dear, the box I'd like to discuss here, yes, the multiple sclerosis. I'm giving a box. The multiple sclerosis, the MS I'm writing here, the multiple sclerosis, the final bottom box. M for Malaise, of course, but M for Malaise, my dear. Malaise means fatigue. Means the 75% of the patients, malaise, fatigue, lethargy. Yes, my dear, this is the final box. I master, this is the final box. 5-star box, my dear. The multiple sclerosis, you can write down the M for malaise is the 75% cases the patient present with the vague symptoms, no symptoms, but the malaise, fatigue, lethargy, sometimes the presenting features. Yes, my dear. So you need to know that sometimes the questions are hitting usually in part 1 exam. The most common symptoms of the multiple sclerosis, yes, in that way. But most common presentation, I should say, this is the young female love matter, because this looks like the MS, is a Malaise, it looks like, yes, my dear, the Malaise.